I'm Kyle. My diagnosis is astrocytoma, grade 4, which is a glioblastoma.
I'm his wife, Rachel, and we have been married for 2 years, together for 5. We live in Colorado. We love being in nature, spending time with our new puppy.
When I was like 26, I was like, my girlfriend at the time was driving me off at my house. My roommates left their trash cans out over the weekend, and I was like trying to see if they were slobs, and I couldn't say it. I was like, they are slow. I couldn't say it, and I got in the shower, and they couldn't. I couldn't say my ABCs. So I thought to myself, if I get to work and can't figure it out, if I can't talk, I would do something about it. And then that passed me by. That passed me by. Because being fine, I know what. When I got to work, and then I couldn't think of the word, but I could say the word. And it was like, what's Pappy? What's Wakafina? What's Vic? And then my girlfriends were like, what's the matter? And I was like, I don't know. And
she thought he was joking. Like he was like, what's an awala? What's this? Yeah. Macaroni and cheese. Like he just didn't know. And then he started vomiting and stuff. And so she took you to the emergency room. Yes. And that was in 2004. They did an MRI and they found a fist-sized tumor in the left frontal lobe of his brain. And they did surgery within like 2 days, a day. Yeah. They were only able to get like 20% of the tumor and told him, you have 3 to 6 months to live. Go enjoy your life. The attending neurosurgeon, he had done his residency at Duke. And so he had reached out to Duke and was able to get Kyle off of a 2-year wait list for what was at the time experimental awake craniotomy. And so he had 2 surgeries within 2.5 weeks. And that surgery, they were able to remove 99% of the tumor.
I was like, no, we don't have 20. No, I don't have 3 to 6 months to live. This is before I knew about the
surgery.
Surgery. I was like, no, I don't. I have a life to live. And all of my friends and family and everyone thought it was crazy. And my parents bought me that house to live in. Been there for 20 years.
They bought it for him to die in.
Yeah, for me to die in.
But he didn't die.
Yeah, but
he's not dying.
Not dying.
We met in January of 2020. We were set up on a blind date. We actually ran into each other in the grocery store 2 days before. So not technically fully blind because we had each seen a picture of each other. But I got in line behind him at the grocery store. And I was like, are you Kyle? And he's like, are you Rachel? And he actually told me when we were walking out of the grocery store, he waited for me and he grabbed my bags for me and carried them to my car. And we were walking. He's like, I don't know what, our friend told you, but I had brain cancer. Like, just so nonchalant. I was like, oh, okay. And I didn't really think anything of it in the sense of like he was technically like in remission at that point in time. So I hadn't known anyone personally with cancer before meeting him. Yeah. And so it was just kind of like, okay, like, there's stories of people who heal cancer and then they enjoy their life. So I just didn't really think much of it, but it did make sense. Like, he had a hard time speaking then. He did chemo and radiation, and he did a trial of taking some crazy dose of a chemotherapy that's usually used for women with breast cancer.
Yeah. 100 milligrams when they usually take 10 milligrams a day. And I was on 200 milligrams morning and night.
So he did chemo radiation for 2 years. He was on treatment.
Yeah. I did 3 kinds of chemo, and I was on radiation for 2 years. I was in remission for like
10 years.
10 years.
Went back to school because they told him drop out of school. And so he went back and got his bachelor's degree in mental health.
Yeah.
He started working in mental health and being a case manager. And then he was doing that job of being a case manager and was having a hard time writing his client notes. And that was the first indication that something wasn't normal. And so he followed up with his oncologist and got a new scan, and it showed that the tumor had returned.
Yeah.
I love you.
I love you.
Well, my parents moved out here.
You had surgery.
I had surgery.
They removed it, and then he did chemo and radiation again.
Yeah.
This time the surgery was not an awake craniotomy.
Yeah.
Whereas the second surgery was.
Your little beehives coming off.
I didn't think I was going to die from it. It's like, wow, I took my job. I kind of happy about it.
Happy about your cancer coming back?
Yeah.
Why?
I don't know. I don't really know.
Kyle's always had a relationship of like, he sees his tumor like almost as like a friend, or it's like a part of him. Like, he doesn't feel, he's never said like, I'm fighting or I'm battling. It's always been, I'm on a journey, I'm healing. Like, this is just part of his story. From my understanding, it's just kind of like, okay, it's just a bump in the journey. We keep moving forward because it's just part of the journey. I mean, and that's how he's been since I've been on this ride with him.
Yeah.
So Kyle was getting every 6 months scans at that point in time because he was just about to hit his 5-year post-recurrence. And he was just going for like his routine 6-month scans. And he had gotten a scan when we first started dating. 6 months into that relationship, went to get a scan. He went by himself because I was like, oh, I don't need to go. It's just going to be a normal thing. And I had a work call. He was calling me and I was like, he knows I'm in this call. Like, something's not right. And so I answered it, and he just immediately started crying and told me that the tumor was back. And it was just like such a shock. We had only been together for about a year at that point. And it was just like, we didn't know what was happening. And so they decided to put him on a chemotherapy drug for a year, and he tolerated it really well, and the tumor stayed stable. And then they gave him a 6-month break to see if it would kind of keep it at bay, that year of treatment, and unfortunately it did not. And so then he tried another chemotherapy, and the tumor was growing on that. So then we went out to UCLA to see a doctor, Dr. Clausey out of UCLA, and he gave us a recommendation of 2 drugs, and one's an IDH mutation inhibitor and then another immunotherapy. And he went on one of the drugs, and we were waiting for the other to be approved, and the second drug was intravenous and the other one was oral. And as we waited for the intravenous to be approved, so he was taking one, and then once he took that drug, his immune system just started failing, and he developed aplastic anemia. So this time last year, he was in and out of the hospital. The doctors were
don't remember much of this.
Yeah, his doctors were like, you might not survive this. A lot of people don't. But basically, your body stops producing new blood cells, and specifically pretty much across all the boards, but your neutrophils, he had basically none. Your body has no ability to fight off any infection, illness.
It was touch and go, but I couldn't be like around anybody. I couldn't
eat anything raw. It was just like scary time. In all of this, we were told that the tumor was inoperable. He's also at his lifetime limit for radiation. But through all of this, Kyle's like the most optimistic person. He's like, I know that I'm going to live till I'm 99. Like, that is the plan. And I don't see it any other way. And me being his caregiver, his wife, I just kept advocating for him because he's very much a people pleaser and doesn't push for other options and other opinions. And I feel like I definitely came into his life to help be that person because there wasn't that person for him before me. My
parents would have just kept me in oncology.
Yeah.
It's all they would have done. And they didn't mean anything bad by it.
But not ask other questions and say, are there other doctors who might have different opinions? But I've always believed that, like, if he thinks he can heal, then I'm going to do everything I can to help make that happen. And so, led us to California to get second opinions. We've worked with a bunch of integrative and alternative doctors. And then in a couple months ago, I don't know how long ago that was, around May, I guess we found out that his tumor was showing further progression.
Yeah.
And over the last few years, there's also been a development of a tumor in the cerebellum. And we just were like, we're not taking this, like, there's no other option route anymore. Like, who else can we ask? And it led us to the most incredible surgeon, Dr. Chris Smith, out of Barrow Neurological Institute in Phoenix, Arizona, September 12th of 2024. We were in Arizona and Kyle went in for surgery and they were able to remove another fist-sized tumor with clear margins. He was able to also get these gamma-tile radiation seeds put into the cavity. They're radiation seeds that emit localized radiation. So when you're getting stereotactic radiation, which is like the most common radiation, it affects all of the tissue around it. So then you can get necrosis and there's much more side effects. Where with this, it's just treating that cavity.
And they're inside my brain.
Yeah. And just the cell, like the immediate tissue around it. So wherever, any left behind cancer cells could have been. And so it can be a much more targeted treatment. And even though he was at his lifetime limit for stereotactic, he was able to get it because it is so localized.
Yeah. And that's what affected my speech.
Yeah.
They
told us, some symptoms or some side effects of the surgery is Kyle could have a hard time with speech, a worsening of his memory. Also, he has some right side weakness and that could have been more pronounced. And he was able to walk within less than 24 hours of having the surgery. The only thing that has been the struggle to come back is the speech. So the aphasia is still very present and he's going to speech therapy to help with that.
And physical therapy and occupational therapy.
Yeah. The recovery has looked like Kyle's doing hyperbaric oxygen treatment, which was recommended by the plastic surgeon who covered up the incision because he still has a little spot that's struggling to heal. And also can just help with strengthening the immune system to help the body to then heal because you're giving your body pure oxygen.
It helps with everything.
And it can also help with cognition. So speech, which hopefully we'll see that as he progresses of doing that. He also goes to speech therapy, occupational therapy, and physical therapy.
Yeah.
And the big thing has just been putting muscle and weight back on. He lost a lot over the last year, having been hospitalized last year and going through the neutropenia. He just lost a lot of weight and it's been really hard to gain that. So
I'm 130 and usually weigh like 155.
Yeah.
It's ridiculous.
So that's been the big priority. And then he takes a lot of supplements.
Yeah.
We try to eat a plant-based, plant-rich diet and and just try to be really mindful, intentional with our time, and we do qigong every day. We sit in tea ceremony. Just find moments of peace and centering. Well, in 2004, it was diagnosed as a GBM. 2016, they downgraded it to an astrocytoma.
Yeah.
And the reason being the grading scale had changed. So it was probably always an astrocytoma. But this recurrence showed that the pathology, it had gone from a grade 3 to a grade 4, which classifies it as a glioblastoma. It was kind of confusing because we read the pathology and we talked with the surgeon, and everyone was just calling it an astrocytoma stage 4. Nowhere on anything, and nowhere were we told it was a glioblastoma. But then we went to see his surgical team here that just like is monitoring like the healing wound, because we live in Colorado and he had surgery in Arizona. And I was telling them the pathology. I was like, oh, it's a stage 4 astrocytoma. And the neurosurgeon was like, Rachel, we're gonna go out in the hallway and like schedule something while Kyle gets he was getting his stitches removed. And I was like, okay. And so I grabbed my phone, and he was like, the worst bedside manner. And he was like, so Kyle doesn't have a astrocytoma, he has a glioblastoma. And I was like, well, that's not what we were being told. He's like, well, I'll pull up Google, like that's what this means. And I'm like, okay, but that's not what we've been told. So it's just like kind of jarring, and also like Kyle should be in on this conversation because it's his brain. It was just like a weird situation, and I just kind of went back in the room like a pit in my stomach and left and told Kyle, of course, because it's his brain and like he should know these things. And I called the team in Arizona and I was like, can you just explain this to me, because we're a bit confused. And they have incredible bedside manner and just are so kind, their whole staff. And I was speaking with the surgeon's like assistant, who is their point person, and he was like, yes, it is a glioblastoma. I'm sorry that this wasn't conveyed more clearly to you. And
if they call it astrocytoma grade 4, it should be astrocytoma.
It's very confusing, and it's very unfortunate for the patients because it makes it so confusing. But speaking with him, he's like, we got to wait for more pathology to come back, because depending on what mutations are present or not present will really dictate on how aggressive this tumor is and if it's really acting like a glioblastoma or if it's not. And so we are still waiting for that pathology 3 months later to come back. So we don't have the full picture of what is at play, but yeah, it was just kind of a shock and confusing. At this point, we're just like accepted that that's the reality of what it is. We found that out maybe a month and a half ago. He just had his first surgery, or his first MRI post-surgery, and the scan is stable. The tumor in the cerebellum is stable, and there's nothing present in the cavity, is still clear. So we're riding that of like everything feels good, and just kind of honestly having a hard time acclimating to like this new version of reality. Kyle sat in meditation before the surgery, like maybe a year before, and his tumor, he would speak to his tumor. He still does, even though it's not there. And his tumor said, just 20 years and I'll be gone. And I just remember it so vividly. He came upstairs and told me it, and I was like, we both were like, we don't know how that's going to come to be, but we both just kind of held that. And I always like kind of came back to that, like 20 years, tumor's going to be gone. And then his surgery was 2 weeks before his 20th alive anniversary. So when he celebrated 20 years from when he was diagnosed, there was no tumor.
And I had stitches in my head. From the surgery. So it was just like this surreal thing. And so his dream and his belief came to reality, and like we're living in that moment. And although we both believed it would happen, it just feels kind of surreal. Like, okay, now what does life look like? Yeah.
Now that we're here in this place that we hoped for and wished for.
Yeah.
And how do we keep those scans continuing to be clear? And that tumor in the cerebellum hopefully continuing to shrink, because has shown marginal shrinkage over the last year. Right now, it's not being treated. Eventually, he'll go back on the Optune medical device, which helps, one, keep that tumor from growing back, and then hopefully the tumor in the cerebellum. We're waiting for the pathology, but mostly we're treating it from a holistic approach, strengthening his own body's immune system. He uses a machine called a Rife machine, which is like an energy frequency healing. He sleeps on that every night. We take lots of supplementation and work with integrative providers for that. It's a hard balance. Kyle's full-time caregiver, and I always joke, but it's so real. I hold both of our brains because he has brain cancer and his memory is not all there, and it's hard to separate that sometimes, but that's something that we're trying to work on, and that's a big focus like for this month actually for us. And just one, for me, I feel like I've had to learn how to really figure out how can I care for myself, and I think that has to be the priority, so that as I prioritize myself, I can also then prioritize our marriage. But I haven't been taking care of me. So that's been the first big step. Also, we're going to start couples therapy.
Just hope. I never once thought that I would die. I still don't think I'm going to die. I'm going to live till 99. But that's just hope. It's never giving up on hope.
Believing in yourself.
And that's hard to do. It's hard to do. But I would say never giving up on hope.
Yeah.
I love it.
I know.
Even when it's hard, you can find joy. Like, I feel like that's been a big part of our journey.
Merry Christmas.
And Happy New Year.
Never stop advocating.
Yeah.
And if you're having a hard time advocating for yourself, get yourself someone that will help you advocate. And don't take no for an answer. Keep searching for the right people on your team.
Yeah.
Because if we didn't do that, he wouldn't be here in this place without a tumor in the left frontal lobe of his brain.
Yeah.